Access to medicines and health products is dependent on a chain of events, and it's complex. There's many different stakeholders involved.
There were lots of calls for fair prices, but nobody was really addressing the how to make real fair prices, and we thought that it would really bring value to be able to give the people a concrete price that we could reach if we had fair prices.
We heard on the panel, and we see in the literature and from experience from different countries that there are different models that are being explored, like milestone payments or like subscription models that they link revenues from a given antibiotic from the volume of its sales. They're also called Netflix models.
I think in general the pharmaceutical legislation has an important scope already when it comes to access and affordability of medical products. There's some transparency requirements there that are very useful.
Is not necessarily where we're going to solve this problem. The transferable exclusivity voucher is not going to get us where we need to be, and I think it's important that we actually consider the alternatives that are also on the table, including in DG HERA.
I think the battles are still to start because we just kicked off the negotiations, so we haven't gotten there yet, but the Commission has suggested in the directive that as of now, marketing authorization holders will need to submit the data on how much public funding they receive from governments.
And we're speaking about the moment from life to death, having a good time when we are here. So when we are ill, then we should have good conditions, and that is something that is a high value and a precious thing that we should take into account.
But if you manage to make the discussion on R&D, transparency in pricing, innovative solutions to push and pull incentives, if you manage to make that discussion exciting, then you have succeeded in pulling off a spectacular event, and that is what has happened today.